people who are dealing with dizziness sort of need a surrogate nervous system at first. And I think that's one of the things that I'm helping them with when they're listening to my voice, even though they may not understand any of it. Because just like you said, I've been dizzy. I couldn't
Yeah.
speak. My brain was not working. So I think the first thing people need is to start hearing messages of safety without any pressure to take anything in, but just to kind of have the
Yeah.
hum of it in the background.
So many of you have told me how scary it is when your world suddenly starts to tilt, when terrifying symptoms seem to hijack your life and disorient things for you beyond recognition. But here's the great news is that these sensations are not random and they're most likely not permanent. And when you understand what's really happening between the brain and the body, things can change and often dramatically. If you're new here, I'm Raelan Agle, and this channel is where we explore what actually helps people move forward from ME/CFS, long COVID, chronic pain, dizziness, and more through lived experience and the latest science. And today I am so thrilled to be joined by the incredible Dr. Yonit Arthur over in Orlando, Florida, better known online as Dr. Yo. Oh, if you don't know her already, you are going to absolutely love her. She is a board certified audiologist and coach, host of the wildly popular The Steady Coach YouTube channel, and creator of one of the most comprehensive free programs ever made for chronic dizziness. She brings a rare blend of deep clinical experience and incredible human warmth. In this conversation, Dr. Yo shares her journey from burnout and chronic symptoms to rediscovering purpose, how she found her path to helping patients with persistent dizziness, and what she learned about the brain's role in creating and reversing these sensations. We talk about why dizziness can feel so existentially terrifying, the difference between what starts these symptoms and what keeps them going, and her powerful idea of giving patients a surrogate nervous system when their own feels unsafe. It's validating, fascinating, and filled with hope and insight for anyone whose symptoms feel confusing or out of control. And before we start this video, I have a small favor to ask you. The percentage of viewers that subscribe keeps dropping. And the bigger the channel gets, as you've seen, the bigger the guests get. So if you haven't already subscribed, I ask you to consider doing so. Thank you, and I hope you enjoy this episode. Dr. Yo, so exciting to have you here. Thank you for being with us today.
Oh, thank you so much. I'm so excited to speak to you, Raylan. We were just reminiscing about the conference that we just attended and sensory overload. We didn't get to have a good in depth conversation there. So it's awesome that we get to do that today.
Back to the world that is 2025 that we don't get to speak in person, but like this,
Right.
like, we'll do this, on video. That's,
Right. In public for everyone to see.
yeah, that's how
Yeah.
we all function in this world. In person was just too much for us to make
It was too
happen.
much. Yeah.
Yeah. All right. So I know a lot of people know about your work. I've had so many requests, by the way, from my viewers and people in the community like, Dr. Yo, are you going to have her on? So I heard you guys and she's here. So very
Thank
exciting
you.
stuff.
Thank
But
you.
for those that might not know your story or your journey, because like so many people, I know you have a personal journey that led you to where you are now, doing the incredible work you do professionally. So yeah, it'd be helpful if you could tell us a little bit about that.
So, to keep things pretty simple, I'm an audiologist by profession, and I've worked as an audiologist for a long time. Burned out because I got into audiology to help people, decided that wasn't happening so much in mainstream medicine. And at the same time as when I burned out, I was also dealing with chronic back pain and a bunch of other chronic symptoms that had kind of crept up on me over the years. That's not what really, I think, led me to do the things I'm doing now, but it helped me understand that it was real, if that makes sense.
Yeah.
It opened my mind up. My mom developed chronic dizziness from Meniere's disease. That's what really was, I think, the impetus that led me to start looking again at audiology, but from a different angle. And essentially, sort of by coincidence, patients started finding me. I went back to work as an audiologist as a contractor, but this time just kind of doing my own thing. And people with PPPD started finding me, PPPD being persistent postural perceptual disorder, which like many of the other terms in our neuroplastic world, is basically just a description of symptoms that means chronic dizziness, and we don't know why. But anyway, people with that particular label started finding me, and I started making videos for them because they needed me to repeat myself all the time. They had brain fog, they had fatigue, they were super anxious, they felt terrible. So I was like, here, you can press the replay button rather than having to ask me to explain this every time. And then people started watching the videos who weren't my patients. And so that's in a very condensed version how I ended up on YouTube and working with all the people that I'm working with now.
Yeah, and there are so many terms flying around, and just to help people understand, because even I'm having trouble keeping up. Like we talk about neuroplastic conditions or neuroplastic
Yes,
symptoms, and we have so many terms that refer to this. So, just for the sake of our viewers, many of which are experiencing brain fog, been there,
absolutely.
hard
Yep.
to wrap your head around everything. So, when you say neuroplastic symptoms, what are you referring to?
Thank you for that question. So, what I mean by neuroplastic symptoms are symptoms that are the result of your brain having a processing error, essentially. So, there are symptoms that are caused by tissue damage or disease or structural problems, like if I have a cut in my arm, that leads me to have symptoms of pain from the cut. And then there are symptoms that basically don't reflect that you have some kind of problem with one of your body parts. It's that your brain is not doing a good job of understanding what the environment is actually saying. It's basically misreading the environment as a dangerous place. And so it's misinterpreting all the information from your senses as something dangerous. And this creates chronic symptoms. So when I use the word neuroplastic, in my world, I call it neural circuit because, why not be a little extra confusing for people, right? Use different terms. When people hear the term mind body, or sometimes people have other terms for it, all of those are referring to this exact same thing. These are symptoms that reflect an issue with how your brain is using information. And because brains are plastic, that's where the word neuroplastic comes from, it means that they're reversible. They're reversible symptoms because there's nothing actually horribly physically wrong with your body that means you can't recover.
So, thank you for that. Very well explained. Much better than I could have done. And even I'm having trouble keeping up with all the terms that we have to cover this. It's
Yes.
yeah. So if
Yes.
you're watching and you're also struggling, it's all of us. We all need to just settle on a word. It does seem like neuroplastics
Absolutely.
seems to be leading the way lately. So we'll see if that one is the one that sticks. But so yes, so many people watching, listening, as you know, are facing conditions like CFS and long COVID, and they have a myriad of symptoms, and quite often dizziness is one of these. So what is dizziness? And is this a neuroplastic issue? Like, what causes this?
Yeah. Oh, dizziness is just, of course, I'm biased, Raelan, obviously. It's just one of the worst because it makes essentially dizziness means you don't know where you are in space. It's a problem with the orientation system. So not just balance per se. A lot of people who are dizzy don't have balance problems, but where am I in space? So I know that's a very broad description, but that's because dizziness can include, I could probably list 50 different symptoms or more that all kind of fall into the category of dizziness. But most often, people who are experiencing dizziness will experience a sense that their their movement or their perception of movement is off. Like they move and they feel like there's a delay. They sometimes have trouble tracking moving objects. They'll feel just kind of off, whether they're moving or not. Some people will feel movement all the time, even when they're not moving, like
Hmm.
rocking, bobbing, swaying. There's vertigo, which is a specific subtype of dizziness, involves spinning. People will feel gravitational pulls, like they'll feel like they're being sucked in one direction or the other. Bobblehead, feeling like your head is on a stick. Sometimes people will feel like their heads just kind of floating above their bodies, or that they can't feel their extremities, like their feet and hands, or they don't know where they're
Hmm.
located in space. Visual symptoms, sometimes things will look really off size wise, like things are they look too big or too small, or you just can't orient when things around you are busy, like there's just too much stimulation or light sensitivity. I mean, I could just go on. We could probably fill this entire interview with just descriptions of these awful experiences. I just want to also very clearly include, because I know so many of the people watching this have this experience as well, of dissociation or feeling like you're not really there or not real. That's a particularly terrifying one that a lot of people encounter. All of these symptoms are from the same place. They all come from the fact that your brain is just not doing a good job of coordinating information from your eyes, ears, and sense of touch. So back when I explained what a neuroplastic symptom means, I said, well, it's when your brain's just not using sense information the way that it ought to. So in this case, the senses that it's not using correctly are three senses. So your eyes, ears, and sense of touch. And that's why there are so many symptoms. Because
Wow.
any symptom that relates to any one of those symptoms and your sense of reality, because when you're not oriented in space, your brain isn't really sure what's real. All of those things lead to that giant list of symptoms I gave you and all the many more that I'm sure people that you see are dealing with.
Wow, that I had goosebumps while you were explaining that. I've never experienced that, but it sounds like a nightmare. I can see how this would absolutely just be so challenging to function when you're facing this. Like, wow.
It's I can't overstate it. It's no one should ever have to suffer through what people with chronic dizziness suffer
Yeah.
through. It's I- I'm certainly not judging other symptoms as lesser than or what have you, but there's something
Yeah.
particularly terrifying on a deep existential level about not knowing where you are in space.
Yeah. And I would imagine that people facing it face an extra layer of stress because it has, it sounds about as serious as chronic fatigue syndrome. When people hear it and then they're like, oh, I get tired too. Or, when I hear about dizziness, I think about, standing up too fast and, having a couple seconds of disorientation and then it passes. It's just no concept of what these people are living with every single day and trying to explain why it's disrupting your ability to function in life when it doesn't sound, so intense. Like, oh, some
Right.
dizziness. Yeah. How bad could that be?
I'm
Yeah.
so glad you brought that up. And that is one reason I'm just so excited to be here on your channel, because I think that the experiences that people who are dealing with chronic dizziness as a primary symptom and the experiences of people who are dealing with ME or CFS or long COVID as a type symptoms as a primary symptom, they have a lot in common in ways that maybe people with back pain or other pain syndromes
Yeah.
don't, because there's a level of debilitation and disconnection from sensory reality and from your life that's different when you have symptoms like these.
So, what is causing this? Is it one thing that's bringing on this state for people, or can it be multiple different things?
When you ask what's causing it, do you mean what brings it on? The initial symptoms?
Why in general is it happening? Like, is it sometimes something structural in the body that has generally caused these symptoms to come about, or is this
Mhm.
purely a neuroplastic issue?
Yeah. So dizziness can be structural. Obviously, people get hit in the head and they feel dizzy, right? So
Yeah.
we always want to check for a structural issue, but by my estimation, the vast majority of people who have chronic dizziness symptoms are dealing with a neuroplastic issue, which I'm glad we already defined so I don't have to
Yeah.
redefine. Um, Meaning, by my estimation, when we're talking about someone who has daily chronic symptoms, I think by conservative estimates, about 80% or more are dealing with a neuroplastic issue. And the way it happens is actually, to me, quite fascinating and also really helps people make sense of their experience. So, is it okay if I explain in a little more detail?
Yes, please.
Okay. So, often what happens is there's some kind of biological thing that happens. Someone gets a virus like COVID, or they fall and they hit their head, or they have BPPV, which is benign paroxysmal positional vertigo. Sounds super, super scary. It's the crystal in the ear problem. Is this something that you've ever heard of? So essentially, it's the most common cause of vertigo. It's easily treatable. Usually people have it. We do a simple exercise with them. They go home. It's done. But any of those things that I just said can bring on initial dizziness symptoms. I like to tell the story of how I got the flu in 2019, I think, or maybe 2020. And my first symptom was dizziness. I got super dizzy because my body was fighting off a virus. It made sense for my body to say, hey, slow down. You need to sit down now because you're about to get sick and we've got the immune system kicking on, right? So a lot of these initial dizziness symptoms make sense from a biomedical perspective or a biological thing that happened. But that's when things change. So, what starts symptoms isn't what keeps them going necessarily. And the problem with symptoms like dizziness in particular, and I would argue fatigue as well, is that it's scary. It's really scary. It's a mind bogglingly terrifying experience. It's not just, my back's really bothering me. Okay.
Mm.
And I'm speaking as someone who had chronic back pain. Or, oh man, I've got this migraine. I guess I overdid it yesterday. Not to say people don't respond to those sensations with alarm, but those are more normal-ish. They're kind of accepted, like, oh, people
Yeah.
experience this. But the kind of crushing fatigue that keeps you from lifting a limb or disorientation that makes you feel like you're not even living in reality anymore, those are not normal
Yeah.
sensations for people. They're not things that people have good words for. They don't necessarily know how to describe their experience. And many people have never experienced sensations like that before. So they start going to doctors, they start Googling, they try to figure out what's going on with them. And usually they're met with no answer at all. Usually, if there was a biological thing, we don't know what it was. It goes away. It's transient, as we say. And then someone very quickly, if their nervous system is already sensitive and is already kind of looking for things in the environment that might be dangerous, the nervous system starts to say, aha, I know what's dangerous. What's dangerous is these triggers. What's dangerous is these symptoms. What's dangerous are the things that have been stressing you out in your life. So many things can cause the brain to what I say is misappraise, but to basically start thinking that there's danger everywhere. And those assumptions can very quickly lead the brain to start misinterpreting sense information for a longer period of time, essentially making what started as just a dizziness thing that may have been scary into something that becomes now chronic and lasts for months and years.
So everything you're saying sounds like it overlaps a ton with what people are
Totally.
going through with ME/CFS and long COVID, and they sometimes have these symptoms as a part of that. I've interviewed people who have talked about
Mhm.
this.
Yep.
I'm wondering because, we see a lot with the conditions that I just mentioned in fibromyalgia that, symptoms move around and they change. And we talk about, one person's back pain is another person's, post exertional malaise or insomnia or whatever
Yes.
it might be. And we talk about things like the symptom imperative and how, symptoms move around and change as your brain and nervous system try and get your attention in different
Mhm.
ways and try out new tactics. So, generally speaking, the approach for those conditions I was talking about is to treat all the symptoms pretty much like they're the same. You're just dealing with a brain and a nervous system response that you're trying to, you know, regulate and rewire. So is dizziness the same? Is it one of these umbrella of symptoms or is it separate? Do you need to approach it in a different way than you would all of those other symptoms that can come along?
I love this question. And I'm going to punt it back to you a little bit and say, as much as ME, CFS, and long COVID have in common with a lot of these other symptoms, they present unique challenges. Because as
Mhm.
we've already discussed, there's something particularly awful about these symptoms. And again, not necessarily the symptoms themselves, but the terror and the disconnection from reality that they tend to produce. So, my answer is it is absolutely the same mechanism. It's the same exact process that causes dizziness, pain, chronic migraine, CFS, ME, same process. The general principles are the same, but man, those details can look a little different. And those are important to people. That's why people come to you rather than say, "Oh, I'm going to watch a
Yeah.
chronic pain channel." They certainly get a lot out of channels that talk about chronic pain, but you're offering a unique perspective as someone who's been through it and really gets this is a little bit different. Let's talk about
Mm.
how and how you can use those exact same tools to break the exact same cycle, but in the way that's right for you, your situation, and your symptoms. Same thing for dizziness.
Yeah, I'm thinking about a lot of the tools and strategies that we talk about. And I'm thinking, how would you even do these things when, I haven't experienced what you're talking about. It reminds me though, like, one time I was, put under for surgery and I came out and it was a really hard thing for me to explain, but the feeling was like I was being tortured. I was so disoriented. I just felt like I'd been like drugged and given 10 shots of tequila. And it was a nightmare. I'm like, I can't function. I can't talk to people. And that's the only piece of empathy that, like, my own experience that I can think of that I've been through where that all of my senses seemed off in that disorientation. So how do you then, like sit down and do this brain training
Oh,
exercise or,
yeah, or
whatever it
journaling.
might be. Let's do some somatic tracking. Like
Yeah,
no
that's
one wants to
exactly
get
right.
further into that experience. I don't. So I guess so that is the $1,000,000 question. So what do people in this situation do? Like how have your clients or what kinds of things have they needed or how do you have to adapt things for them to work through this?
Excellent question. Oh, you're just asking the best questions, Raylan. Okay. So I think the first thing, the way that I think about it is people who are dealing with dizziness sort of need a surrogate nervous system at first because
Hmm,
their own nervous system, I know I just
I
literally
love
came up
that.
with that in the moment.
Really?
But
That's brilliant.
yes,
I'm going to be immortalizing it from here on out. As Dr. Yo
fantastic.
says, you need a surrogate nerve. It's so true for
It's
many
exactly
cases.
right. But
Yeah.
especially when your
Yeah.
entire nervous system is like, I don't know what's
Yeah.
real. Like, let's start with foundational reality. Don't have that, right?
Yeah.
People need a surrogate nervous system at first. And I think that's one of the things that I'm helping them with when they're listening to my voice, even though they may not understand any of it. Because just like you said, I've been dizzy. I couldn't this happened to me very recently, actually. The most recent time was when we were in Boulder, Colorado, and I went through the elevation change. My system totally freaked out, and I got intense dizziness and disorientation and dissociation. And I could not take in what people were saying. I couldn't
Yeah.
speak. My brain was not working. So I think the first thing people need is to start hearing messages of safety without any pressure to take anything in, but just to kind of have the
Yeah.
hum of it in the background. So this is where listening to your channel, listening to my channel, other channels that are talking about this, people need to not worry about the content at first. Just let us be a surrogate nervous system and then find other ways in your life of creating or scaffolding a surrogate nervous system. So that may mean very basic things like sticking to a routine, which I know is very important for ME CFS as well. Um, these are, again, it's not so much about what you're doing with these things, it's about receiving this message of safety and how you're doing it. So you're not trying to extract something from it. You're not trying to go through this routine or listen to these videos for the purpose of engineering your entire recovery at first. You're just trying to get your nervous system back online in some way. So I think that's the first step. And then I think from there, we're going to education where people have to understand what's going on. And so the education, I guess, happens in two acts. It's first just, okay, there's hope, and I'm just going to keep listening to these videos and get hope. And I'm going to maybe have a routine where I just can my body can start to get used to me doing something and expect something because that's safety. And then after that, it's really starting to take in the information a little bit more. But then that's where some of the general techniques that we use in neuroplastic treatment world are really challenging to implement for dizziness. So you mentioned somatic tracking. Things like graded exposure can be really difficult because your
Mm.
symptoms, as you said, symptom imperative. Well, Dizziness symptoms are particularly prone to this because, as I said, you have a giant menu. Your brain doesn't
Right.
even have to shift modes to start
Oh,
producing all sorts of wacky new symptoms that have to do with your eyes, ears, or sense of touch. So things like, okay, I'm going to do this graded exposure thing and it's going to get better and better. That's not necessarily how it's going to work with dizziness. Tracking symptoms. How do you track something like dissociation? Or how do you track something like
yeah.
disorientation or vertigo, which lights up your fight or flight system so much that it's physiologically almost impossible to track without completely freaking out. It's happened. I've
Um,
seen people do it, but it's really that's advanced level somatic tracking. That's not where people need to start typically. So what I'm usually doing is is first educating people on what I just said, but also teaching people to think of this as a process of self-relating differently. So rather than thinking of a specific technique or tool as the way to get better, thinking of it like my first priority here is the fact that my nervous system does not know where I am in space and it's terrified. And that likely reflects both symptoms and a long history of maybe relating to myself poorly, not having safety, being disconnected from myself is one way people might say that. So building self-connection, in other words, is actually the goal of all of these tools. They're just tools to help you get there. I had a woman in my coaching group yesterday, brand new, who said, I'm just worried I'm not doing it right. How many times do you hear that every day, Raylan? Right?
yeah.
I know because the stakes feel so high when you feel so bad. And I said, if you're doing it in the backdrop of self love, you are not going to go wrong. Pick a tool, any tool, and as long as you are treating yourself with deep love and compassion, it will do what you want it to do. Because in this case, again, the goal isn't, oh, I'm going to rewire my brain by exposing myself to a certain kind of light. It's
Oh,
my brain needs to know that I'm okay. And that is how you teach it that you're okay. Those tools are just means to that end, if that makes sense.
I love that. That's such a great way to explain it because I find that many of us in this world facing these conditions can take anything helpful and turn it into something
Totally.
really not good for us. Like,
Yes.
okay, like I'm going to change my diet and I'm going to obsess over every bite of food that goes into my mouth and it must be organic and locally sourced and or okay, brain retraining. I'm going to be like my own drill sergeant and make myself do it 100 times a day and I'm going to be so hard on myself if I only do 99. And so yeah, like it's there's so many tools out there and it's what I hear time and time and time again from people that self-compassion, peace, and love is so important. And joy, like it should feel like a gift, something that you're doing for yourself. And if it feels like a stressful chore, then it's
That's not
time
it.
to step away from it. Yeah.
And I hate to say it quite this way because I certainly don't want to put this on people, but it seems like dizziness is self-correcting in that way. It will not work if you don't approach it in the way that I just suggested because
Um,
any urgency, any pressure that you're putting on yourself in that way, your system again is so sensitized when you have dizziness that it it will not work. It will not work. So my advice to people just in general when they're looking at all these tools and they're like, "OMG, like you're telling me to do what? Like all these things." I have a bazillion videos, you have a bazillion videos. People will
yeah.
obsessively watch everyone and be like, "How do I implement any of this?" We can make it really simple. Just the basic principle is pick something that appeals to you and
Mhm.
do it in a way that is not urgent and that is caring for yourself. That is actually going to be what helps your nervous system know that you're not in serious danger. And then you can adjust from there. I think of it like any other relationship. I said self relating before, like you're thinking about it as a way of building a relationship with yourself, connecting with yourself. Just like any other relationship, a relationship with yourself takes time and energy and investment to build. So think about the way that you're doing somatic tracking or graded exposure or journaling or any of the other
Mhm.
tools. If you're doing it in a, I'm going to blast this symptom right out of my system and then I'm going to go on and live my life like that. Imagine, Imagine trying to make friends with a neighbor in order to say, maybe your neighbor bakes great pies. I'm sorry, I'm really into food right now. So it's around lunchtime for me. So my my neighbor bakes great pies, and I'm like, I really want my neighbor to bake me a pie. Would it be helpful for me to go to my neighbor and be like, bake me a pie? I demand it. Do it, right? It's not going to do
Yeah.
anything. No, you'd have to cultivate the relationship. There has to be a relationship. There has to be trust first. So what you're doing essentially by doing the using the tools in the way that you and I are talking about is building trust, and then you can start making requests, but you have to build the trust first.
Um, I love that. I'm gonna be using that one as well. That is
Wonderful.
such a great way to visualize it. Like, "Bake
Wonderful.
me a pie." I'm gonna tell you 100 times a day.
I know.
I'm pretty sure it'll work. By the end of the day, that pie
That's
will be
right.
ready and
I'm
life will
just
be
going to do it
good.
louder tomorrow if you don't
Yeah,
listen too.
exactly,
So, yeah,
exactly. If 100 didn't work today, I'll do 150 tomorrow.
exactly.
Yeah, I'm gonna
Exactly.
wear you down. So I'm wondering on that same sort of, note, we find a lot with some of these other neuroplastic symptoms, a lot we find with ME/CFS and long COVID is that some of the biggest gains people see in their symptom reduction is actually all those breaks they take from just stopping trying to fix themselves and just finding little pockets of joy despite all the symptoms that are going on and just
Mhm.
to live a little bit and just feel a little bit lighter and stop trying to fix things. So I'm wondering, does that also apply here? Because that's a pretty challenging ask when you've got so many things going on
Yeah.
symptom wise.
Yeah. Yeah. And admittedly, because I have a bit of a bias, right? Because I see people in states of absolute terror day in, day out. So
Yeah.
I sometimes forget to think about that, how important it is to not, maybe not like find joy. Maybe it's not joy that may be too high of an ask, but
Right.
meaning, meaning would be good.
Yeah.
Agency. So I think, Raylan, now that I'm saying this out loud, I think those are the two that I really focus on: meaning and agency a little bit more. And meaning, well, obviously something that's in alignment with who you are and your values. And
Yeah.
then agency, meaning I'm not a victim to this thing anymore. There is something I can
Yeah.
do. Those are a wonderful, not stand in for joy, but those are a
Yeah.
wonderful way to start. So you may not chemically be able to feel happy when your brain's like, I don't even know what reality is,
Yeah.
but you can still find meaning, and you can still find some way in which you are still here. You are still in control. You are still you. No matter how bad you are, you can always find meaning and agency. And that's, I think, why that education piece is so important, because it helps people find their agency again when they realize, okay, it's my brain. Okay, this lady is saying, maybe there are some habits I can change, or maybe I can do this, maybe I can do that. Rather than focusing on the doing that, focus on how it feels to know that there is something you can do. And that can be a stand-in at
Yeah.
first for joy.
Yeah, I love that because that's what it felt like. My joy feels like a really big ask when you've got all of that going on. And on my health recovery journey, a turning point for me was when I started to feel like I had some control over things, even though I still felt like a bag in the wind most days with symptoms coming and going, and like a puppet with someone else pulling the strings. Throwing as many mixed metaphors as I can, but but
We're
yeah, once
we're
you
kindred spirits.
yeah, I just want to make this as confusing as possible. But yeah, once you feel like you even have the tiniest bit of control over what's happening in your life, and people tell me this is where the recovery stories help them so much because even if they haven't seen that progress yet, they see all these other people that have had somewhat similar situations that start to move past it. It's like, okay, they can do it. I can do it. And I might not even be moving the needle much yet, but I'm going to borrow their, belief and their hope and like, okay, I can do this. I can do this, which has got to
Mhm.
be one of those initial feelings of safety for people of like,
Yep. There's the
okay,
surrogate nervous system, another
there we
example, success
go.
stories.
Yeah.
Yeah. Yep. Yep. Big
Yeah.
time success stories. But
S-
that, there you go though. That also opens up agency. May not be joy, like I'm happy
Yeah.
about this anything right now, but she did something. She's sort of my surrogate nervous system. If she can do
Yeah.
something, maybe I can.
Yeah. So, also in the people that I interview and talk to, we find that there are certain places or things that commonly trip people up or can keep them stuck or stall their progress. So, I imagine you see this with the people you work with as well. And if so, what are some of those things and how could people, I don't know, minimize the impact of these things?
Yeah. Some of the things I'm going to say are going to be so obvious, but it's just it it bears all the repetition in the world because these things are so important. Okay. So, in my world, because dizziness brings on so much anxiety on its own, this is not even a neuroplastic thing. Dizziness comes with terror, it comes with fear because you're disoriented. It's part of the symptoms. I also see a lot of people with obsessive compulsive or intrusive thoughts.
Mm.
So, I think the most important message I want people to hear is you need to stop searching for your symptoms on the internet. You need to stop trying to find medical sources that are going to fix you. You need to stop having chats with one of the AI agents now about your symptoms. You need to once you have the diagnosis of neuroplastic or neural circuit dizziness, there's nothing physically wrong with you. We need to let go of the diagnostic labels, and the only thing that matters now is that it's your brain that's producing the symptoms. Now we need to shift our focus to dealing with that. We're no longer in the medical world. We need to get out of that. Similarly, so I don't know that the last few years have actually been particularly tumultuous, but there's definitely a perception that they have been, current events being very up and down over the last few years. And so the way I think about current events is just like I wouldn't let my 8-year-old watch a horror movie. I'm not letting myself watch the news obsessively because it just sends my
Yeah.
nervous system into unnecessary chaos. Similarly, people need to protect their nervous systems by not being in those social media groups where all you see are horror stories. They need to get off those sites immediately, leave those groups,
Yeah.
silence them, mute them, sign out, don't sign back in. Those messages are the anti-medicine. They are
Yeah.
what you're taking in from your channel, Raelan, from my channel, from other people in the neuroplastic world. That is your medicine. That is injections of safety when you don't know how to create safety for yourself. So when you are in those social media groups, you're taking you're taking in venom. You're taking in something that is literally collapsing your nervous system rather than making it stronger. So you need to leave them. Again, I'm sure I'm preaching to the choir. You've probably told people this all the time, but I guess that's where I really want to start. Those are the most
Yeah.
important things. When you've already done those things, then I think the most common pitfall after that is people feeling like sort of what we've been talking about over the last few minutes, that they have to use a tool perfectly or that there's a specific
Mm.
magical tool that's going to fix them. I say this all the time. I tell my people, if there is one tool to rule them all, I promise I will put out one last video and I will go do something else.
Yeah.
I will start a soup YouTube channel. I promise you, the only reason
Mm-mm.
I have as much content as I do is because there's no one thing that works for everyone and there is no magic tool. And I will be the first one. We can do it together. We can make a joint announcement, Raylan. We have found the one magic tool that rules them all. This is the solution to everything.
Yeah.
People come in with that mindset because they're scared and desperate. And because in Western medicine, that's
Yeah.
often how we think about problems like this.
Mhm.
I promise it's not going to work. So it's not about what, it's about how. It's about how you're approaching the tools. It's about what your goal is from the tools. It's not about which tools you use. That applies just as much to every neuroplastic symptom, I
Yeah.
think, not just to dizziness.
I find too, in a lot of the people that I interview and talk to, they find the most success with tools when they adapt them. They're like, it doesn't really resonate how that person is explaining it, but I think I'm going to do it this way, or I'm going to change
Hmm.
the words, or the way the duration I do it, or when I do it, or how I do it. And that's such a great message because I think we used to think of it almost like some magic potion, like
Right.
say these 7 words, do these 6 movements, and you will be fine.
You
And
will be healed.
you can't get one out of sync, otherwise the potion won't work. But yeah,
Right.
yeah, yeah,
You know, to me, what you just said is so wise. And under the hood, we are back to self relating, in my opinion. So you are supposed to adapt the tools. It's not just that it's okay to adapt the tools.
Right.
You're trying to build a user manual for your own nervous system. You're trying to really connect with and know yourself. And the whole point is adapting tools. The whole point is you being responsive to yourself in that way and saying, okay, this somatic tracking, this graded exposure regime, whatever regimen, these are things that are a great starting point for me. And they're great, especially when you don't have a lot of safety, when you have tons of fear, just follow the 1, 2, 3, 4, 5 step process. Absolutely. But the
Yeah.
goal is for you to be able to create your own multi-step process because you're you're different from you each. Obviously, this is the most obvious thing ever, but you are an N of one. You are a unique individual. What works for someone else may not work for you. You are supposed to adapt it, and you should not just feel, again, allowed to adapt it, but rather empowered to adapt it, knowing that adapting it, you being even a little playful with it, is also really showing your system, hey, I'm interested in you and interested in getting to know you. It's safe. It's safe for me to play around and change things up a little bit.
Yeah, I love that you point out that are all used to, especially from the conventional medical system, being or given a literal prescription for what to do to get better, and that can feel easier or safe. Like we want someone to say, "Do this 4 times a day for 3 minutes," like on Mondays, Wednesdays, and Fridays. We want something very specific, so it can sound a bit unsettling at first to hear that you have to figure it out on your own, but where most people come to that I interview, my own experience echoes this as well, is that it's a great feeling. You get your power back. You're no longer waiting for someone out there to be your magical cure or your cure. You're like, I've got the ability to turn this around, and I am the expert on my life and my body and my nervous system. And if what someone says doesn't sound good to me, I get to completely disregard it. Like I get to put it aside and move on because I'm the boss of me. I'm driving this ship and I know me best. And that's not a message that virtually any of us have gotten from the medical system. Like you show up passively, you know nothing, and you were told, what you and your body need. And sometimes, of course, the conventional medical system has a ton to offer, especially with acute, emergency situations. Like if you
Absolutely.
break your arm and they're saying you need a cast, I would say most likely go along with it. But yeah, with the chronic conditions like this, it's a completely different scenario, and it's I think why most people come out the other end of it, in a much better place. Not something I expect people to appreciate or even worry about when you're in it, because it's a hard thing to have gratitude for when you're in it. But yeah,
Absolutely. I say the same thing. And
yeah,
the way I see it is something about the way you were living your life wasn't working for you. It wasn't because
yeah,
you're you were set up for chronic symptoms before you ever had chronic symptoms. Your system was sensitized in some way. Sensitized
yeah,
just meaning your system was already kind of a little bit like, okay, I'm really not sure about all this. That's not a good way to live. It's not. And I hear this resoundingly over and over again from people I interview for success stories and people I don't interview for success stories who get better. They're honest with themselves about that, about what was and wasn't working, and they start to live their lives differently. And just as you said, I don't expect people, especially if they're at the beginning and they're terrified and everything is just complete chaos and awfulness, to appreciate that.
yeah.
But I I think it's important to say it because it's also a message of hope and safety to know that there's something you can do, that there's meaning in what happened, and that you can turn that meaning into something much bigger than recovery from symptoms.
This is incredible. Every sentence of this has been pure gold. I am going to be quoting you until the end of time.
Thank you. Especially the pie metaphor. I mean, that was peak. Yes.
Oh, so many, so many, too many to count. I'm gonna have to go back through the transcript and pull out a bunch of them. But so for people that are aware of everything you have available, if they're also thinking like, yes, this is gold, where can I get more of this? Like, what do you have available for people?
So much free stuff. So much free stuff.
Yay.
Almost all the stuff that I have is free. I have a YouTube channel, The Steady Coach. I'm sure you'll link to it in the descriptions of things. I have a free course, and that is my most important offering. It's I I think I feel like we have like 21,000 people who've taken it now. I mean, it's a
Wow.
lot. It's completely free. It basically what it does is organize all my YouTube videos with information so that you know how to implement things step by step.
Yeah.
I thoroughly believe all this information should be out there for free. If you need help with it, I also have coaching groups. I have a kind of a structured week by week thing, but all of that is completely optional. The information is out there for free. I also have an Instagram that I'm really bad at updating, but sometimes I do. So people can check that out as well.
Oh, so amazing. Yes, this will all be linked. I'm so excited that we've connected. And I'm going to link here for people to a list of full recovery stories. There are tons of them there. So if you're looking for some hope, if you need a surrogate nervous system, just bookmark some of your favorites and they'll be there waiting for you. Dr. Yo, oh my goodness. Absolutely amazing. So excited to have you here. The work you're doing is incredible. I can't even imagine the impact overall that you're having on the world. Just so grateful for you that we've connected, that you took the time to speak with my audience. Just thank you. Thank you for what you do. And just thank you for being here.
Thank you so much for letting me share some of my insights with you guys. If you're out there with ME and CFS, long COVID, and you have dizziness, I promise you, you can recover from those symptoms too. You're going to be
Yeah.
okay.
So helpful to know, especially for those extra scary symptoms, because then it could feel like I'm never going to get past this one. And
Yes,
then you do, and it feels like it's going to take a lifetime. But things just start to fall into place, symptoms start to reduce, and you get to feel okay. Okay.
that's it.
Wonderful. All right. Well, thank you to everyone who's watching. Thank you again, Dr. Yo. And for people watching, I hope to see you in one of these recovery interviews. Bye, everyone.